All right, good morning, everybody. Thank you so much for joining us. Um, 1 second here. There we go. Um, this is Amber of the Washington State Department of Agriculture, and today we are here to provide an update on the highly pathogenic avian influenza strain, H5N1, that has been detected in our state. Um, our first report was in a backyard flock was on May 5th. Since then, we've seen 9 flocks in 7 counties become infected. We continue to emphasize the importance of biosecurity, and we are actively working with flock owners statewide to provide the best information and resources possible. Giving the update today is Washington State veterinarian Dr. Amber Itle, and on the line to answer questions is Dr. Dana Dobbs, our avian health lead. I would like to remind you to please keep your microphone on mute and your camera off. And after our experts give their update, you can go ahead and use the raise hand function to ask a question, or you can ask it in the chat. Please go ahead when I call on you to say your name and what media outlet you are from. And now I will give the floor to Dr. Itle.
Great. Good morning. Does that look okay to you, Amber?
It looks perfect.
Okay. Good morning, everyone. As Amber Betts mentioned, I'm Amber Itle. I'm the Washington State veterinarian, and I'm really happy to have along with me today Dr. Dana Dobbs, our avian lead and our commercial flock coordinator for this response. She's just done a fabulous job. So I'm really happy to have her here to help me answer questions. I'm going to go ahead and just give you a brief overview of what's going on across the country as well as what's going on here in Washington. So as you know, this outbreak has been going on for several months in our country. We are one of the last states to get hit. We really thought we were going to get out of this, but we didn't. So far, there's been 35 states, 338 premises, with 38 million birds impacted by this virus. Over half of those across the United States have been commercial flocks. Those are large commercial flocks that are being used for our table eggs and poultry that we get every day at the store. And then half of those are backyard flocks. So those designations are made when we do those responses based on whether or not they sell eggs or whether they sell poultry products. In Washington, we've had 9 detections in backyard non-commercial flocks. We're very fortunate so far, fingers crossed, that we can keep it out of our commercial flocks. And Dr. Dobbs working very closely with our commercial industry to try to safeguard those flocks to provide food security for all of us. So seven counties with the most recent detections in Thurston County. Not too far from the 2 premises we had in Pierce County last week. So just to reframe that, in Washington, we've had 7 counties now with 9 detections, most recently in Thurston County. We're also seeing an increase of wildlife detections across the state. In other flyways in the Atlantic and the Mississippi and Central flyways, they all saw detections of highly pathogenic avian influenza in wild waterfowl prior to getting any detections in their backyard flocks or their commercial flocks. We haven't seen too many detections here, but now as we're seeing more backyard detections, we're also seeing far more detections in wild waterfowl. The Department of Fish and Wildlife has confirmed highly pathogenic avian influenza in 12 counties across Washington, including in birds such as bald eagles, Canada geese, snow geese, sandhill crane, a red-tailed hawk, a peregrine falcon, a great horned owl, and a mallard duck. And all of those birds have presented with neurologic signs, or they're just appearing dead. People are finding them dead. And so those neurologic signs mean the bird's having difficulty walking. Maybe they lack fear. They're just kind of stuck there. They're very lethargic. Their head may bobble. but they're definitely not acting normal. This presentation is kind of unusual for what we usually see with highly pathogenic avian influenza. Typically, the strains don't cause any clinical signs in waterfowl, but this year it's very unique in that it's having much more of a severe impact on those waterfowl species, especially geese. We've seen similar presentation of this virus in domestic backyard flocks, flocks that have geese or ducks. We are seeing an increased morbidity or sickness and increased mortality or death in those birds. And so that's very concerning to see that. We also just seem to see sudden death with chickens, turkeys, peacocks, guinea fowl, but it does seem like it's impacting those geese at a level that's a little bit different this year than other years. So far, all of our domestic flocks have been identified from owners reporting on our sick bird hotline, and they've all reported increased sickness or increased death rates in their flocks. So far, our veterinarians at the Washington State Department of Ag have done a fabulous job, including Dr. Dobbs, fielding over 65 sick bird calls. So we really are grateful that people are calling us and letting us know. And sometimes it might just be one bird, but we're going to call you back anyway. Our veterinarians follow up on every single call to help identify the risk, talk you through biosecurity, and figure out what the best plan is for your farm. So we do encourage you to continue to call the sick bird hotline whenever you have any kind of mortality or morbidity event on your farm. We know that based on looking at the flocks that we've seen so far, out of those 9 flocks, all of them have had contact in some way with wild waterfowl. 7 of those 9 flocks were mixed domestic flocks, and what that means is they have gallinaceous birds or poultry like chickens, turkeys, guinea fowl, peacocks, and they're mixing them with domestic waterfowl such as geese or ducks. And the 2 flocks that were not mixed flocks, one was all geese, and they had direct contact with wild geese and shared a water source. And the other flock was all chickens, but they had made friends with a pair of mallards that came in and lived with them and cuddled up with them at night and shared feed with them in their chicken coop. So we've been able to identify these risk factors in all of the flocks, that, all the flocks have either shared feed, housing, or a water source with waterfowl. So when we think about this disease and we think about disease mitigation, we certainly think about what are the common risk factors that we've seen in the flocks thus far that have been infected. So the important question today is, how can we all continue to work together to prevent further detections in Washington? We really want this to go away. We don't want anybody else to lose their birds. It's extremely difficult to go through for both those bird owners, the birds themselves. We're concerned about animal welfare, and then also our response teams. We're working really hard to get out there and try to contain this disease and prevent the spread. It's not an easy thing for anyone to go through. So first thing I want to do is I want to thank everybody out there, because we've had these Facebook groups going, and we've taken a lot of email and on Twitter, and there's just a lot of communications work being done where people are talking about this and asking questions and telling their story of the things that they've done to help mitigate the spread of this and help to protect their flocks. And I know it's hard, and I know it's taken people a lot of effort and time to implement those steps. So I want to thank those people who've gone out there and brought their birds in and brought them under cover and put tarps over their coops and fenced them out of those common areas where wild waterfowl hang out. Keep them away from ponds where we know that there's probably going to be some environmental contamination, especially if wild waterfowl is living there. So first and foremost, thank you so much to everybody who's out there doing their part to help prevent any further infection of avian influenza here in Washington. Because like I said, it's just a very devastating thing for people to go through, and we don't want any more detections. So thank you for helping us do that. So I think the most important thing, and we're going to continue the same messaging that we've been doing, is keep birds away from direct contact with waterfowl, just for a few more weeks. If you can just hang in there a couple more weeks, even if you could do it for 30 days after the last detection in your county, that would be helpful. We also need to keep an eye out for those wildlife detections, though, because as long as we're seeing it circulate in the waterfowl and in the wild birds in our state, we can't feel 100% safe. It's really hard to put a number on, well, when is it safe to put those birds out there? What I would say is, if you have a pond and there's wild waterfowl there, there's ducks, there's mallards, there's snow geese, there's Canada geese, and you know they're spending time there or they're hatching goslings there, you can assume that there's a pretty high viral load out there in the environment. So what you want to do is wait for summer, let things dry out, let things warm up, let that virus die. It's not a very tough virus, but it can persist in a cool, wet environment, which unfortunately we're seeing that this spring, that it just doesn't want to let up. I think I just read that May's been one of the wettest springs we've had in a really long time, and so that's not helping us get rid of this virus. So hang in there. And if you can just hang in there with these biosecurity practices, and when we say biosecurity, we just mean risk mitigation practices. What can I do to reduce my risk? Keep doing those steps for just a couple more weeks, and let's just pray that summer gets here soon so that we can all go back to normal. The other thing that we have decided to do at the Department of Ag here is to reduce the risk of commingling. We know there's risk. Anytime we bring birds in from multiple places, multiple types of birds into one location, it's an extremely risky environment for spreading that virus, bird to bird and farm to farm. So we have made some recommendations to temporarily suspend exhibitions, shows, swap meets, and even poultry markets as early as this morning. I think that press release went out as well. And we've talked to those livestock markets. I know at least 2 of them have already decided to voluntarily stop selling for a few weeks just till things calm down. Because the risk is if somebody brings in ducks or geese and they're carrying that virus and maybe not exhibiting clinical signs and expose other birds at that market, then everybody who's at that market on that day or at that exhibition on that day has then been exposed. And then we're going to send that out to all those different buyers at those markets or swap meets or all those exhibitors that are there that might have had contact. And it would just be really devastating to not take this precaution now to where we could actually, impose this risk mitigation piece to really help prevent the further spread of avian influenza in the state. And that includes things like Craigslist. I know a lot of people like to do Craigslist, or maybe there's some online app, or maybe you're buying things off of Facebook. That's not really recommended right now. It's a really high risk time to do something like that. We would recommend, if you just can't help it and you just have to do that at least you would isolate those birds for at least 30 days after you bring them into your farm. So that means you would isolate them away from everyone else so that you can monitor those animals for any clinical signs for up to 30 days so that you reduce your risk of bringing anything into your flock. And that's not just for avian influenza, that's just good practice for any avian disease. And there's a lot of endemic avian diseases that look like avian influenza. So we just want to take those precautions while we can. If you do have a bird that's sick, please call us. As I mentioned before, Dr. Dobbs is doing a great job of fielding those calls, and she'll make sure that a veterinarian returns that call for you. So just a reminder to poultry owners, report those mortality events. If you have a wildlife mortality event, we just really want to reinforce you need to call Fish and Wildlife, not the Department of Agriculture. Okay, but if you have a domestic bird that's your pet or that's in your backyard flock, that's when you call us. And just remember not to freeze those birds, but just to keep them refrigerator on ice, preferably not in your refrigerator next to your food. So even though we don't think there's much of a public health problem with this at this point, this seems to be very low risk, we still don't think it's a good idea for you to put any kind of dead birds in your refrigerator. So we also want to thank our response partners, USDA, the Department of Fish and Wildlife, Department of Health, Emergency Management, and so many more people who've been involved with this response. Our veterinarians are working very long days the last couple weeks trying to get this disease contained as quickly as possible so that we don't spread it to anyone else. We're certainly very concerned about animal welfare, and we're concerned about the people who own those animals and their own mental health and welfare. So thanks again for this opportunity to give you a brief this morning on what's going on here in Washington. And Dr. Dobbs and I are happy to entertain any questions. So thanks again.
Great. Thank you so much, Dr. Itle. I just want to remind everyone it's now time to ask your questions. Please stay on mute and use the raise hand function. I will unmute you and you can ask your question, or you can put your question in the chat.
I might suggest sharing the question that was asked in the chat that you responded to, but for the people who don't see the chat, that might be great to share.
Okay. The question in the chat was, what 7 counties have outbreaks? And the answer to that is Pacific County, Clallam County, Spokane County, Whatcom County, Okanagan, Pierce, and Thurston.
I might suggest sharing the question that was asked in the chat that you responded to, but for the people who don't see the chat, that might be great to share.
Okay. The question in the chat was, that was strange. Whatcom County, Okanagan, Pierce, and Thurston. Okay. Okay, it looks like we have a question from John Lobertini. So I'll go ahead and unmute you.
Hi, John Lobertini, Como Radio. Can you go back to the live market crackdown? Can you hear me?
Yes.
Yep, we can hear you.
Okay, I'm sorry, I'm having some feedback here. Wait, let's. What about the live markets? Are you concerned about? Obviously, you're concerned about the spread between birds, but there will be people there manning those markets. Are you concerned about a possible human transmission? Feedback here.
Dr. Itle, you're muted.
Dr. Itle, you were muted. I think I got you unmuted now.
There's something weird going on though with some of the, it's almost like something's playing over and over again.
Those markets. Are you concerned about?
There we go. It's almost like it's playing back the question. I don't know, it's weird. Okay, sorry, I'll try again. I'll take that question. So great question about markets. Yeah, I mean, when we think about asking for these types of temporary suspensions at markets, you know, there's lots of reasons that we do that. We don't like to mandate it. The reason I didn't mandate that we stop and we ban all markets and exhibitions and that sort of thing is because what ends up happening is people just take their sales out into the parking lot. And then we have zero traceability of those animals. So what I wanted to do is mostly do this for a bird health point of view and for a lack of spread point of view. We really don't think there's a big public health implication at this point with this particular type of H5N1. We've had thousands of responders out there at commercial and backyard flocks across the country for several months. There's only been one case detection, and that was in Colorado for one of the workers that was responding and had a lot of direct contact with a lot of birds. At this point, from what I last heard from the Colorado State vet, they can't be sure that it was an actual true infection. He tested positive on PCR, but that could be picked up on a surface. And they were waiting on some serology to determine if it was actually a true infection case. But so far, really doesn't appear to have any human health risk. What we did do is, I think one thing that's really important for folks on this call to maybe understand is that the veterinarians at the Department of Ag have great relationships with our markets because we spend a lot of time there for other, type of animal compliance and animal health regulatory type issues. So we know our market owners, we know the people who sell things there. We sit down and have coffee with them. In fact, that's what I did just yesterday. I went into the market and I sat down and I had coffee with a bunch of guys and we talked about avian influenza. And so it's great because we have strong relationships with them. We actually are there every single month and we do routine surveillance for avian influenza throughout the year. This isn't new. So when we go in and talk to these markets about, hey, here's the risk involved with doing this type of activity, they've been quite receptive. And what we did is rather than doing a ban, we actually sent a letter with some recommendations for, hey, if you continue to do these sales, here's some things that we would like you to do. We'd like you to, make sure that you don't sell any sick birds. So if you see something sick, we want you to call us and send that bird home and we'll contact that seller and we'll test those birds at that farm of origin so that it's not putting other birds at risk. We ask them to separate waterfowl that they sell from other poultry. So we want them to sell poultry first And then we want them to sell waterfowl second. So if that's what they choose to do, we want them to keep birds in individual boxes. We don't want them to take birds out and put them into communal cages. And then we talk a lot about cleaning and disinfection between birds, between sales. And then we talk a lot about that record keeping requirement. So what we do, at the state vet's office is we do a lot with animal disease traceability. David Hekimovich is our ADT coordinator, and he's just a critical piece to how we do our work, because if we don't know where birds came from and we don't know where birds went, we don't know where that disease potentially could have gotten to. So we use records from markets to be able to trace birds in and out of markets, to be able to find those birds, test those birds, and rule out whether we've got disease transmission. But to be honest, it would be a total nightmare if we had avian influenza at a market or an exhibition, because you start to think about the numbers of people that are there and how many people would be impacted by that type of response. So we think prevention or just suspending those sales temporarily is the best way to go at this point. And I know I went beyond your question there, but I think it's really important to kind of let you know our process, let you know that we're there anyway, let you know we've got great relationships with these people, with 4-H leaders, with FFA leaders, with the fairs themselves. We also do routine avian influenza surveillance at fairs, our 14 biggest fairs in our state, every year, just as our normal book of work, not even during a outbreak. So we do rely on those great relationships and those great people there to help us carry out our mission for disease prevention and containment.
Great. We have a question from N. Jennings. You put a question in the chat, but you also have your hand raised. Do you want to ask that yourself, or do you want me to go ahead and ask?
The last time I tried WebEx, my volume didn't work. Can you hear me?
Yes, I can hear you.
Perfect. Yeah, it's Nicole Jennings with Cairo News Radio. I'm wondering about how much danger our pets are in. Specifically, I'm thinking about cats that go out and catch birds. I mean, is this dangerous for cats and for dogs? Is this something where we should be watching what we drag in on our shoes, that they could be exposed that way? What is the outlook for pets, and how does the disease behave in them if they can get it?
Oh man, I love that question. So first of all, I think what we need to recognize is that most influenza viruses are species specific. All right, so we know that avian influenza is very unlikely to infect a cat or a dog. We do know they can act as fomites, just like we can on our feet. They can carry that virus around on their paws. So if they're out running around a pond and they're chasing geese and there's a lot of contaminated material out there around those ponds, they can certainly carry that virus around on their paws. But there is another piece to this. So yeah, they can carry it. They can be fomites just like us. We can carry it on our shoes and carry it on our car tires. But just last week, both, I want to say Wisconsin and New York and Ontario confirmed detections of H5N1 in wildlife, in wild mammals. So I believe there were some kits, some fox kits that were diagnosed with H5N1. And there was also a skunk. And I saw it on the map today when I checked the Department of Fish and Wildlife, I think the National Wildlife Services map. They actually have a map on there. And so it's worth a look. So as far as how this virus is behaving, well, we don't think that it really infects mammals, but it looks like it can, especially in animals that scavenge. And so I think that I don't know that there has been no cases of cats and dogs diagnosed here. However, I would take those precautions because we don't always understand how viruses are going to behave. If you have a dog that likes to go out and catch geese or that sort of thing, I would be very careful. And if you find dead birds, I would try to remove them as quickly as possible, because that's what we're seeing with bald eagles, other scavengers that are eating these infected birds. That's how they're dying. That's how these, the great horned owls and all of those types of birds of prey are dying, because they're eating these dead or sick birds. I mean, they're easy prey, right? They're just sitting there all neurologic and curled up. They're easy to catch. They're easy to eat. They're free dinner. But unfortunately, it doesn't end well for those birds. So I can't say there's any science to back up this recommendation, but what I would say is I would not be allowing your dog to go out and eat a dead carcass of any type of waterfowl, Cats typically are too small to do that. And, you know, songbirds really don't seem to be susceptible to this type of virus. So if they eat a bird, it's probably not a big deal. I don't really see a cat eating a duck or a goose, but, you know, a dog might be higher risk. But again, there's no science to say that the virus can infect them. But I think based on what we're seeing in other wild mammals, such as skunks or fox kits or fox, I would just take that precaution. Doesn't hurt, right? Don't let them eat dead things. It's always a good idea not to let them eat dead things.
Okay, and we have another question here, and it says, if we buy chicks at the feed store, is that still safe?
Dr. Dobbs, do you want to take that one since you run the NPIP program?
Sorry, can everybody hear me? I missed that part of the question. Sorry. Say again.
Yep, it says, if we buy chicks at the feed store, is that still safe?
Yes, a lot of the feed stores source their chicks directly from National Poultry Improvement Plan certified hatcheries. And as long as those feed stores are not in a control area, which would be a quarantine zone, which is near an infected flock, commercial flock specifically, it should be fine. But like was mentioned before, if you have other chickens or waterfowl or anything like that in your flock already, it's best to isolate those chicks from the rest of the flock for at least 30 days. But as of right now, the chicks should be fine.
Awesome, thank you so much. Do we have any other questions? Just a reminder, you can raise your hand in the raise hand function, or you can pop it into the chat. And then we'll also check YouTube to see if there's any questions coming in there. Oh, okay. So there's a couple questions here. The first one, how does this year compare with previous years? When was the last year that was the most like this? And when was the last year that was the worst?
Okay, I can take that. I have a slide up in front of me so I can cheat here a little bit, but we did have an outbreak of highly pathogenic avian influenza here in 2014-15. I think we had about 5 flocks here in Washington, but across the country, it involved 15 states. This year's 34 states, and in 2014-15, we had 50 million birds impacted compared to 36 million this year, 38, I think I said earlier. They had 99 confirmed wild bird detections in 2014-15 compared to this year, where we had 950 wild bird detections. And we've also found it in 60 different wild bird species this year, which was completely different than 2014-15 when it was mostly just in dabbling ducks. So we have many more wildlife species carrying this virus, which is likely why we have such a high environmental load, because so many more birds are carrying the virus. And so everywhere they land, we just have much higher potential for environmental contamination. We also have this great technology called whole genomic sequencing, which allows us to determine exactly whether that virus was a point source infection or whether it was a transmission from farm to farm, like a horizontal transmission. So like I drove my truck from one farm and I took it to another farm. What they found is in 2014-15, we only had 2 point sources of infection, at least in commercial flocks in the Midwest where they had the big outbreak. Whereas this year, in 2022, almost 86% of all the whole genomic sequencing has indicated that they are separate introductions from waterfowl, which is really different. So despite all of our efforts with biosecurity, we're still seeing these separate introductions of like either direct contact or some other way that these birds are infecting these flocks. I mean, as far as cost goes, we don't have a way of comparing cost yet, but we know that both the one in, I think I've seen different numbers for how much this response costs, but it was like, I don't know, over $1 billion response in 2014-15, and this year is probably well on its way to being similar, because there is an indemnification process, and we can speak to that more if people are interested. I'm not going to go into it in this minute unless people are interested after I answer the rest of this question. But we also are continuing to see trade impacts. So there has been some changes in the way the OIE designates some of these flocks as poultry and non-poultry. So in 2014-15, we had 56 trading partners impose complete or partial bans on us based on this disease. That has a huge economic impact for our industry. And this year we have restrictions from 20 different states. And I'm not sure how many different countries are involved with that. Both this year and in 2014-15, the virus had low zoonotic potential, but it is looking really different. And we have to remember that every year that we have avian influenza, it can look different. It can show different clinical signs. It has different pathogenicity. It can be zoonotic, meaning it can have a public health risk, or it may not. It just depends on how that virus reassorts and how it expresses itself in those birds. So hope that's complete.
Wonderful. Thank you so much. The next question is, what might be risk from a domestic flock separated from a pond with waterfowl when they fly over the pen outside chicken yard?
Yeah, I mean, we know they're flying all over the place, but think about it this way, like dilution is the solution. So if one bird flies overhead and poops, could that happen? Yeah. What's the probability? Probably not that good. What's the viral load in one single dropping? Well, it may be there, it may not, but really where we're seeing the impact is that, it could be dose dependent. So in other words, the more virus you're exposed to, the higher level of virus you're exposed to for a longer amount of time, the more likely you are to get infected. So, in flocks where we haven't had any flocks, to be honest, that have been completely shut out of a pond area that just has an enclosed area where, they've been infected. That just hasn't happened. So again, I think it could happen, but the risk is much less likely than birds that have that direct contact with waterfowl or are living in an environment where waterfowl live, and we have that really high viral load and that constant exposure to that contaminated environment where they're much more likely to become infected.
Great. The next question is, I want to confirm the comment on songbirds. Are they not at risk?
So songbirds are not thought to be susceptible to this particular avian influenza virus. However, they can act as fomites or carriers like we talked about before. So on their feet, on their bodies, on their wings. I know there's a lot of discussion about bird feeders why should we take those bird feeders down? Well, those bird feeders attract birds that are then all commingling. We talked about commingling, why that's risky. They're all commingling in one place. They can carry the virus around on their feet. So if those bird feeders become contaminated, now we have a source of contamination that's going to be spread and fly out everywhere and who knows where. The other thing bird feeders do is they spill feed over onto the ground. So we're attracting waterfowl to come and get free lunch. We also are attracting rodents to that same area, and rodents can also carry this virus around on their feet. And so although we don't see many songbird mortalities due to avian influenza, because again, they don't seem to be a primary susceptible species, they can play a role in disease transmission.
Wonderful. And I saw Dr. Dobbs had a pretty good tip here in the chat, and I wanted to see if you wouldn't mind saying that for everyone to hear, because I thought it was really good.
Okay. One other thing that's happened that we've seen in some of these flocks that have become infected is that they are watering their poultry with pond water or irrigation water and things like that, which can certainly introduce the disease to the domestic chickens and waterfowl. So I would definitely suggest during this period of time that only municipal water or well water, fresh sources be used to water the flocks, because you do take the risk of getting fecal contaminated water into the flock in that regard. And I've seen it more than once during this outbreak already.
Wonderful. Thank you so much. The next one is, Do you have any thoughts about why this year is so bad? Is it mostly just the weather, or and where is the relevant weather?
Yeah, I think the reason that it's so bad this year is because of the number of wild bird species that are susceptible. So like I mentioned before, in 2014-15, it was mostly just dabbling ducks that seemed to carry this virus. This year, there's 60 different types of waterfowl or shorebirds that have been identified to carry this virus that have been confirmed through laboratory confirmation. So part of it is, I think part of the reason it's so bad is because we have so many birds that are vulnerable. And so we have a lot more opportunity for these birds to spread it between them. And then for whatever reason this year, just the way the virus decided to mutate, it seems to have that much bigger impact on geese and even some ducks, where they're actually getting sick and dying, and then they're, exhibiting clinical signs. And the problem is with waterfowl getting sick and dying is then we also get raptors involved, we also get birds of prey involved, and then they're also having that impact. So I think one of the reasons it's been so bad is because, one, it makes waterfowl sick. And two, there's a whole lot many more bird species that are susceptible to this species. And I think three, for us, I think we thought we were going to get out of the woods on this, but we've had such a late spring, and as these birds are maybe a little bit slow getting up to Canada and getting up to Alaska, we want them out of here, but some of them seem to be lingering. The other thing I think we're seeing a little bit, I don't know, it'd be interesting to hear from some folks out there in the field, but it seems to me that a lot of geese are coming and staying and having their goslings here. And so if they're infected, we just have that higher risk because they're going to stick around till those babies grow up. So I'm a little bit worried about that. Dr. Dobbs, did you have anything else you wanted to add to that? Why you think the virus is worse this year?
Not at this time. I think a lot of it just has to do also with the late migration that's happened, but nothing more to add.
Great. Next question is, any idea where the wild birds have picked this up from? And aside from each other, where did the virus originate?
Yeah, well, it's really interesting. The virus has been here forever. I mean, birds carry influenza viruses all the time, every year. Probably, if you think about it, human populations, we circulate human influenza viruses around every year, and they're always a little bit different. So if you think about on the human side of the house, you know how some years we get an influenza vaccine and the doctors are like, well, we made our best guess based on what we saw last year for the vaccine this year. So you go and you get your vaccine, and usually by the end of the winter, they're like, yep, that was a good match, or nope, it wasn't a good match at all. Because, influenza viruses are very unpredictable, and they reassort and they mutate, because it's in the best interest of that virus to stay viable if it can figure out a way to get around vaccines, if it can figure out a way to be more contagious, it can figure out a way, usually what they want to do is be very contagious, but not be very deadly, because that usually keeps them persisting longer, so it's in the best interest of the virus to do that. But influenza viruses aren't new. They're always here. And if you're not familiar with this, Google migratory maps for waterfowl. Very interesting. So we have these 4 very distinct flyways. They overlap in some places. But what you'll notice is they all sort of come together up in northern Canada or in Alaska. And so up there, we have this opportunity where birds from Asia, birds from Europe, they all hang out together and they mix. So they all got their own viruses, and they go out on dates and they have big summer parties, and they switch around viral genetics, and those viruses reassort. We never really know what they're going to look like when they come back in the wintertime. So this fall, again, we're going to be, holding our breath again this fall, because we don't know what the virus is going to look like this fall. In fact, it was predicted that we were going to get avian influenza last year. We prepared and we did all these things and we did all this outreach. It never came. We thought for sure it was going to come based on what we were seeing in Europe and Asia. And then this fall, same thing. We're all holding our breath. Here, it's going to come, and it never did. And then this spring, we were like, woohoo, we're getting out of this, And then here we are. We never would have dreamed that we'd be mid-May and experiencing this type of outbreak. But again, something happened this summer where when those birds were hanging out, wherever they were in South America or wherever they were, they reassorted viruses in some way, or those viruses mutated or changed in a way that was more deadly, more pathogenic to other birds, and very contagious, obviously, because we've got a lot more birds that can get this virus, carry this virus, give it to each other. And then also, there's that trickle down or spillover, I guess, into our domestic poultry and backyard flocks. So viruses didn't just get here. It doesn't come from any one place. They're always here. They just present in different ways. And you can also think of this in terms of COVID and COVID-19 and all the different types there are. There's Delta and there's Omicron and there's, I don't know, there's always a new one, seems like. And it seems like every time there's a mutation, it's like, oh, well, this one's more deadly and this one's more contagious and this one's really pretty mild, but everybody gets it, but they get over it, So it's very, very similar with avian influenza viruses, where they're always changing, mutating based on the stressors that those viruses experience. They're going to keep changing so that they can continue to persist in those birds.
Wonderful. I love the having a summer party. That was a good one. The next question I have here is, how are you preparing the commercial flocks in case there is a detection in the commercial? In case there's a commercial detection.
I'm glad you asked, because I was going to put in a plug for our producers. We've actually been preparing for some time. Actually, I will tell you that back after the 2014 and 2015 outbreak, the National Poultry Improvement Plan came up with the 14 biosecurity principles. And what that made people do was take a look at the different functional areas, such as rodent control, for instance, or cleaning and disinfecting and sourcing of birds and things like that. And they had to come up with biosecurity plans. And it's gotten even more stringent now, because with the threat of avian influenza ever present at this moment, in order to safely move products such as eggs and chicken, and they find themselves, now we're in a control area, it means they have to get permits to move these products safely so that we continue with our continuity of business, the food supply, safe food supply. So they have been actively updating their biosecurity plans and leaning forward and figuring out how that they can enhance the biosecurity practices that are already in place every single day. We've been having multiple meetings with producers, and everybody's been leaning in really hard to try to prevent a commercial introduction, because as you can well imagine, that would be devastating to the industry in that there would be hundreds of sometimes thousands of birds that would have to be depopulated, not to mention how that would affect the food supply and everything else. And plus, some of our commercial producers in Washington are 3 or 4 generation farmers, and it would be absolutely devastating. So I will say that everybody's very concerned about this virus. They are doing everything in their power to prevent it from getting introduced. And they've been cooperating with both WSDA and USDA, all of our partners, in how we can best prevent this happening. And just like everybody else, they've been holding their breath and hoping this will just literally fly on by. And but they are asking for the the backyard flocks to please do your part, please help out, because a lot of backyard flocks are right next to these big places. And if you get a backyard flock that's infected, that really puts the commercial producer at risk. So they are asking everyone, please help us contain this virus. And hopefully we can get through this all together without many more detections, if any. Thank you.
Great. Thank you, Dr. Dobbs. It looks like we don't have any more questions. I'll just give a minute to let anyone ask one last question, and also want to give Dr. Dobbs and Dr. Itle just another chance. If there's anything that you feel like we need to add, you can go ahead and do that. I just want to say thank you so much to both of you for giving us your time and your expertise. And it looks like Dr. Itle may have something to say.
No, I was just going to say thanks to everybody. I want to thank everybody here who's on the call today and all of our media groups for your interest in this, because if it wasn't for you, we can't get our message out to everyone, and so that people have an awareness of how important this is for everybody to be part of the solution. We can't do this by ourselves. But I want to thank everybody here for the way that they've handled this. I've seen a lot of radio reports and newspapers, and and I want to also give a lot of credit to Amber Betts and Carla Salp here. If you haven't gotten on the website to look at the resources they provided, please do that. They've done a phenomenal job with not just the press releases, but they're keeping some tables up to date with how many flocks, what kind of flocks, how big are those flocks. They have an interactive map on there now where you can look and see if you're in a surveillance zone or not, so you know if a detection was close to you. They've got up-to-date information on our sick bird call line, all this stuff. There's lots of great resources. They started a Facebook page. They've got 2,500 people on there. There's so much great information flowing right now. And what I'm loving about this is that we're getting good, true science-based information out there. I know that we're all battling a lot of conspiracy theories right now about whether this virus is even real. Let me tell you, it is real, and it is difficult, and it's devastating, and it's sad. We're all really worn out, but and mostly because with these backyard flocks, all these backyard flocks have names. It is just so sad. And when we talk about depopulation, there's not usually many left to depopulate. And when we say depopulate, we should say euthanize, because I do want to make clear that we do euthanize birds. We don't depopulate them in our state. We use humane methods that are approved by the American Veterinary Medical Association. But these birds are dying right before their owners' eyes. Lots of birds, very fast. So it's really hard. And so we found ourselves, both our producers, our backyard flock owners, really struggling with their own mental health to get through this. We're struggling as veterinarians to do it ourselves because it's hard to watch. It's hard to support people through this because, again, we're in this business to make animals better, not to euthanize animals. But when you see animals in pain and you see animals suffering, unfortunately, that's the only choice we have. So all I can do is really put a plug-in out there that we need to just keep trying to help our backyard flocks understand what they can do to mitigate their risk so that they don't have to go through this. The people who've gone through this can tell their stories, and they're really difficult stories. So anyway, thanks again. Appreciate your interest in this issue. It's very important to us, and I'm glad it's important enough to you that you showed up today. So thanks so much.
Wonderful. Thank you so much, Dr. Dobbs, Dr. Itle, for joining us. Thank you to all the media that joined us today. And you can watch the replay of this on our YouTube channel. And if you have additional questions, feel free to reach out to me and I can get some answers for you. Again, thank you so much for joining us and have a great day.